Hi, Dr. Kimberley Wilson here from Inspire Physical Therapy. I want to thank you for joining me for this presentation over the diaphragm, pelvic floor, and the core. I'm super excited to be going over this topic. Certainly something that we address here on a daily basis at Inspire Physical Therapy, working with a lot of pregnant and postpartum moms, and I'm happy to be sharing this with you today. So, before we get started, let me say thank you again for joining me. And if you happen to be watching this on YouTube, please like our channel and subscribe to our channel so that you'll get notified when we put up new content. And absolutely feel free to share it with your friends and family and anybody that you think could benefit from the kind of information that we put up on our channel. So let's just kind of get that out of the way, and then we'll start talking about this hot topic today. So, the diaphragm, the pelvic floor, and the core in the postpartum body. An interesting topic. Let's just get right into the slides, and that will kind of help me facilitate the things that I want to talk about here. So the interaction between these three structures in our body is important because we want to look at it holistically and think about functionally how these structures affect our body. So sometimes we call that functional anatomy, just meaning that we're not pulling out these structures individually without considering how they work together and how they might be impacting the various parts of your body as you go about your functional and daily life. So that's the key part, I feel like, in as we start to dive into this subject a little bit. Okay, so these structures, when you think about them together, it's quite often in the pelvic PT world that we call that an abdominal canister, meaning diaphragm sits at the top, pelvic floor sits on the bottom, and then the structures that sort of wrap that space is the transverse abdominis, the internal obliques, and then from the backside, the metaphyseal of the spine, and sort of form this canister wall, if you can sort of visualize that with me a little bit. So key to the efficiency of this canister is the breath work. Yes, us pelvic PTs are all about the breath work. There's two phases to breathing, of course. Inhale. On the inhale, the pelvic floor and the diaphragm move in a downward motion. Pelvic floor is lengthened in that position. The diaphragm is actually shortened in that position, but they work together to sort of move this canister along. So if we're getting good inhales, what we like to see is expansion at the chest. So ribs will expand outward from the front, from the back, from the sides, in hopefully a 360 kind of motion, 360 degree kind of motion. Inhales will drive the sympathetic part of the autonomic nervous system, meaning it's those inhales, if we're not careful, that can really drive you into a fight or flight kind of state of mind. So if you think about it, if something's got you kind of upset or anxious, it's that kind of breath, right? So that's going to drive you into a fight or flight response. And the exhales will do the opposite. So they will support that parasympathetic nervous system, rest and digest. The diaphragm at that point is moving more in an upward position. Pelvic floor follows. They both move upward into a resting state. At that point, at the end of that exhale, that's when the diaphragm is at its most lengthened position. So a lot of times I'll tell my clients, think about it like going all the way to the end of that exhale. so you can't get any more air out. And it's like stretching your diaphragm the same way that we stretch our hamstring if we're trying to improve the mobility and the function of that musculature. So diaphragm's no different, very muscular, and we want it to go through its full range of motion. So those are the two main phases of breathing. If we move on over to the next slide, you will see that, let me get to the right page here. Those phases of the exhale we spoke about just a second ago, but what I want to point out on this particular slide is there are a couple of ways that I use that exhale in my clinic. It's going to be more of a passive exhale if what I'm looking to achieve is working on that autonomic nervous system. If I'm trying to support my client's autonomic nervous system and help them to restore a more rest and digest environment in their body, then we're going to work on passive breath. Nice deep inhales and just relaxing, slow flowing, but emptying exhales. A kind of a good rule of thumb in general is to think inhaling for 6 seconds and exhaling for 6 seconds so that they're both phases are very slow and controlled, and that is super beneficial for supporting your nervous system. If you're feeling stressed or anxious or just overwhelmed, it's very restorative to just work on the breathing and visualize the movement of all three of these structures that we're talking about today. Secondly, you can use a forced exhale. You could think about it with like sound, so sort of that forced breathing. That will engage the core muscles more, and it will also engage the pelvic floor muscles more. So you can use that forced exhale as a training tool to meet your body where it's at, but also allow you to get back into movement more safely. So for instance, lifting car seats, going up and down stairs, getting in and out of bed, all those functional movements can be a bit challenging in postpartum, especially if those three components are not showing up like we want them to. So that's a good rule of thumb for that active exhale, is to support the core itself. All right, so we're going to move on. All right, let's talk a little bit about the three diaphragms in this abdominal canister. We have the upper diaphragm, which is the throat or the glottis, and then the mid diaphragm, which is the respiratory diaphragm up under the ribs. And then lastly, we have the pelvic floor diaphragm, which sort of forms that bottom part of your canister. So when we think about those three diaphragmatic structures, it's really important that those are not only connected, but they're in good alignment so that communication is efficient between those those three structures. For instance, if I have somebody who is in a lot of forward head posturing, so that happens a lot in postpartum for sure because we're caring for an infant. And so a lot of the things that we're trying to achieve, we're looking down to achieve them. We're cradling the baby, we're nursing the baby. Just a lot of our actions drive that head down or head forward position. And so if that is the position that we're in when we're trying to breathe or restore function, it's not going to communicate very well with the other two diaphragms. So we need to work on posture and creating, safe positions to practice our exercises in that support good alignment of those three diaphragms. Restoring that efficient pressure between all of those structures within that abdominal canister is also important to support your body through the healing process. One issue that often occurs is diastasis recti. It's something that a lot of moms are concerned about. And if we don't apply the appropriate pressure within that abdominal canister, then that's going to make it difficult for the diastasis recti to go back together. So, working to restore that can help your body to heal. And then also thinking about fascial injuries that happen at the pelvic floor level within the muscles and the fascia. Certainly, there could be a traumatic injury through a vaginal delivery, but also a cesarean section can result in some fascial injuries to the pelvic floor. So restoring that pressure through all three of those diaphragms is super important to support your body in the healing process. So how do we, see if I can get my computer to work here. Yeah, how does it all work together? So we want to look at the muscle structures themselves, the abdominals, the diaphragm, certainly the psoas and the TFL, and the paraspinals and the multifida, in the back. So how does that all work together? Well, during pregnancy, I want you to imagine this with me. So baby is growing, and if we just start by thinking about the three structures that I mentioned at the beginning of the slides, which is the diaphragm, the core, and the pelvic floor, as the baby grows, he or she is putting pressure up on the diaphragm, out on the core, and down on the pelvic floor. So those are the three areas that we want to look at in postpartum if we're having any negative issues. You're going to have either core imbalance, an ineffective diaphragm, or an ineffective or potentially an overworked pelvic floor that's contributing to whatever your symptoms might be. So yes, we have to look beyond that canister, certainly above the canister and below the canister, because a lot of times that's where the symptoms are going to present. But it's these three primary systems that are going to be the drivers of whatever dysfunction that you're experiencing. So I developed this little diagram, and it's something that I keep in my head a lot of times when I'm working with a postpartum mom, because I think it helps sort of, first of all, it helps you to kind of visualize how all these systems work together in a postpartum body, but it helps me to just kind of like go through the steps in my brain depending on what I'm seeing in front of me. So if you look at the center here where I have the circle, if we have core imbalance and an ineffective diaphragm and pelvic floor, that's going to equal poor stability at the pelvis and the spinal level. And if we have poor stability, that central stability that is dysfunctional, look at the right-hand corner of my diagram. You're going to have a TFL that starts to overwork because it wants to help you stabilize the pelvis. You're going to have a tight psoas because it now feels like it needs to help you stabilize at the spinal level. And if you have a tight psoas, that's going to result in a rib flare because it originates at the back of the diaphragm and the low spine, so L1, 2, 3, 4, 5. And as it swings around the front, if there's tension in that psoas muscle, it's going to throw your ribs forward and you're going to end up with a rib flare. And if we follow those things down, we see that because we have a tight TFL, a tight psoas, and a forward rib posture, now we have decreased core control and poor diaphragmatic movement. Since the diaphragm sits right under those ribs like an umbrella, if it gets tipped forward because of the rib flare, now you have poor diaphragmatic movement. And then pelvic floor can't respond like it needs to is either. As we move around the diagram, we see that all these things then result in that tight TFL. The TFL is responding to the psoas, essentially, because the psoas is a primary hip flexor, but it really can't do its primary job of hip flexion because now it's trying to be a spinal stabilizer. The core, if there's poor core stability or poor core control, the primary muscle there is the transverse abdominis. That's a horizontal stabilizer, but the psoas is a vertical stabilizer. So those two work in conjunction with each other. But if TA, transverse abdominis, is not doing its job, psoas will try to pick up the slack and help it out. And then it sort of becomes a bully and it hates to let go. But that's what we end up with. We end up with a tight TFL trying to help with hip flexion because of its location into the IT band. Then that impacts the glutes, and now we have glutes that aren't showing up, glute med, glute max, not showing up because the TFL is trying to run the show. And then the circle continues. We get increased pelvic floor compensation because now pelvic floor wants to help stabilize everybody, and so on. We go back into more decreased diaphragmatic function, efficiency, movement, ever how you want to think about that. And it all comes back just full circle, one thing leading to another and then circling back. So if I think about the client in front of me and I visualize this sort of circle of dysfunction, then I start to ask myself, depending on the patient presentation and what kind of symptoms they're having, I try to figure out at what point on the diagram, what point in this circle, can I jump in and then start to be a catalyst for change, so that all things start to work like they're supposed to. And I usually start with breathing. That's very foundational and restorative. But everybody's a little bit different for sure. Everybody's individualized. But the primary thing to keep in mind is that you become a catalyst for change and that you support your client somewhere on that wheel, that circular wheel of dysfunction, so that change starts to happen. Sometimes it happens rather quickly. It just depends on the individual in front of you. But then also it can take quite a while too to restore some of these things. I always try to remind my moms that it really can take up to a year for postpartum recovery, before you start to feel like yourself again. So it just depends. Just depends. All right. Key points to keep in mind. You don't want to leave those dysfunctional movement patterns in place because the change is much less likely to happen. As pelvic PTs, we're always looking for, what are you currently doing that seems to be driving or supporting these dysfunctional movements, and how can we jump in to start to change the wheel of dysfunction and start addressing some of those limitations and help your body to restore itself. At the end of the day, we're looking for healing, we're looking for restorative movement, and we want to start to build in those automatic movements, those automatic muscle motor patterns, so that your body starts to do its thing without you having to intentionally think about it all the time. And it will happen. We just have to develop a good exercise program that starts to build in that repetition, that automatic piece of it, and get you moving back and feeling like yourself. So that's the end of my slide. I try to keep it brief, but then I always think about more things that I want to say. So I hope that you find this information valuable, and I hope it gives you some little nuggets to investigate your own health, investigate your own rehab recovery in postpartum. If you have any questions, absolutely feel free to comment, reach out to us here at our office, and be happy to assist you in your postpartum recovery. And thanks again for watching. I look forward to talking again. Bye.